I really am wanting to ask you, how important is a multidisciplinary approach to law practice, and how do you really advocate others to that?
That's a very, very important question. As physicians, we've been working in silos all the years. I'll just give you a simple example. My father had a bypass operation in Bombay in 2008. He was advised low salt diet, low fat diet, and brisk walk for 45 minutes. What does that mean? It means nothing. Unless you are. So, what is a low salt diet? You're not collaborating with a nutritionist to actually figure out what's a low salt diet. You're not collaborating with a physical therapist to look at what is a brisk walk. I can walk at 1 kilometer an hour and call it a brisk walk. Or someone can walk at 7 kilometers per hour. So how do you define a brisk walk? How do you define diet? So the question is, when I talk about multidisciplinary, I'm not only talking about doctors here. We need to understand, we need to loosen our systems and start integrating people from the allied services also, because heart disease or cardiovascular diseases or any other disease is basically a conglomeration of a lot of challenges. It also requires mental health issues. There is a cognitive behavioral therapy that needs to be done. How do you ask a person to reduce weight? Are you going to be putting him on a GLP-1 all his life? No, you'll have to actually use methodologies where you have so I use a multidisciplinary approach. I collaborate with all my friends in our fraternity, which means a neurologist or a psychologist or a psychiatrist or a cardiologist, as well as the allied services who are physical therapists, nutritionists. So because without this, we are going to make it a failure. We're going to keep on adding to the burden of the disease that we already have.
Thank you for that answer.